As the council's cabinet member for adult wellbeing and health, to be honest, I've been acutely aware of the challenges facing the care sector during this crisis, and I know we all have. I'm also mindful of the exceptional work that's being carried out in care homes, supported living environments and home care by our most dedicated staff who are looking after our vulnerable citizens in what are exceptional circumstances and putting themselves at risk to care for those that need it most. And I'd like to pass on my sincere thanks to everyone who's been involved in the ongoing provision of adult social care during this difficult period. Thousands of older people in our county, parents, grandparents and our neighbours simply could not have managed without them. Providers of adult social care have been under significant pressure during this crisis, and it's a testament to these organisations and to every one of their staff that they've maintained and continue to deliver the essential care and support to those in need. Of course, as we're all aware, the biggest single challenge that these services have faced is their difficulty in accessing personal protective equipment for their staff, particularly face masks. And this was a national issue, and we know how much these supplies were under pressure. We wanted to do all that we could to support the care sector and work tirelessly to track down our own supplies in Northumberland to ease some of the pressures on the care providers. And I have to say the response was phenomenal. We were able to source significant PPE supplies and set up our own operation through our community hub at Blythe Sports Centre to get supplies out to those that needed it most. While much of this work went on behind the scenes, we also received a number of donations, including PPE and hand sanitizer gel from both the communities and businesses. And I'd like to express my grateful thanks to the local businesses, the communities and the individuals who provided these essential supplies. And I'd like to say too to the care staff across Northumberland who are all helping to support what are the most vulnerable people in our communities. So thank you for everything you've done, and it's very, very much appreciated. I think we're now going to hear from Lucy Craig from Craig Healthcare, a care provider who works out of Cramlington House, who was at the very cold face of the pandemic. Thank you.
My major aim, my goal was to protect my residents and protect my staff to as much as I possibly could. For me, this was the single most important thing that was going to happen in the care industry in our time. We'd never experienced anything like it. And it was our time as carers to step up. And if we couldn't step up now and deliver over and above what we've been delivering all the time, then, kind of why were we doing this? I'd say two things that I say to people on a daily basis, okay? I am in the business of caring, and I care for every single person that touches my life and touches the lives of the people that we look after. It doesn't stop at, just caring for a resident. Having had the outbreak at Cramlington, what that has allowed us to do is it's educated us, at such a top level. What it's driven myself to think, and Gemma, my manager that I work with, is we need to actually fundamentally look at how this care model is delivered now going forward, because it has changed. We need to listen more carefully to the local authority. And I have to say, hand on heart, if it wasn't for my local authorities, I wouldn't have got through this. They are actually the only people that have offered a bit of help and support and been at the other end of a telephone. We need to look at the relationship with care homes in the NHS. It's not great. I at times have literally had to beg for a bit of help and support. That needs to be looked at. But my home in Long Benton, which has stayed negative throughout this, in some respects, that's kind of more of a concern for me, because, inevitably it will have an outbreak, and it's kind of when will that happen and in what environment. My exit strategy from COVID is going to be a good 3 to 6 month exit strategy. And, we can't just open our doors tomorrow and go, right, okay, this goes back to normal. But what would assist us all is if, as a group of providers and as the local authority and as the NHS, we could actually just sit down together and talk about the learnings that we've got and then take that forward, because every single day of the week, there's 3 separate individuals here who are just not sharing information, and I am desperate for that information to be shared with me.